Does your child or clients have difficult time going to the doctors, dentists, haircuts? Does a game or an activity or something your family loves to do suddenly get unpaired and the child is freaking out? Today, we're covering all about what to do with desensitization. Hi, I'm Dr. Mary Barbera, registered nurse, autism mom, behavior analyst, and best-selling author. Each week, I provide you with some of my ideas about turning autism or signs of autism around. So if you haven't subscribed to my YouTube channel, you can do that now. So today we are sharing a snippet, a few minutes long, of a classic rebroadcast that we did on desensitization. And it sounds like a huge word, and it is, but it means pairing or repairing any activity, game, procedure. You know, there are medical procedures that your child has to tolerate. There are just even some kids really have a problem with haircuts and all kinds of things. So today we are talking all about that. For complex skills, we're going to need to write down the actual steps of where they're going to lay for their eye drops and how this is going to take place. So we need to determine where the location is that we're going to practice trials. So are we going to practice wearing a smock for painting at preschool? Are we going to practice that in the therapy room, at school, or at home? For eye drops, where's the location we're going to practice? Okay, the child will lay on a beanbag in the living room for the eye drops. Where are we going to practice haircuts? The child will sit in a chair in the kitchen to practice haircuts. And then after we practice haircuts, then we will begin to move that practice to a child-friendly barber. For simple skills like tolerating wearing a swim vest or a smock, we may only need a data sheet to track like duration that the child tolerated and the reinforcement that was given. But like I said, for these more complex tasks, we're going to have to really write down the steps and work on the child. As I said, I did do a video blog about going to the dentist, and I showed a video of my son Lucas where we practiced. I bought a little dental kit. You can actually buy these like fake little mirror that goes in your mouth and fake instrument to take the plaque off at the dollar store or on Amazon online. So I got this little kit and to practice, and he sat in the recliner in the living room. And then I was able to say, we're going to practice going to the dentist, sit in the chair, tilted the chair back, then put a tea towel over him to mimic the bib that would be on him, then use the mirror and the pick to count his teeth, to pair up just somebody in his mouth. And that was an example where we paired that up. But even for some kids, they're going to need this kind of procedure even to like cut their fingernails or their toenails. And I know I'm guilty of this. So if anybody's out there listening and thinking, oh my gosh, I do that. You know, when kids are little, to avoid the freak out, you know, I've cut Lucas's fingernails and his toenails. And I know some people even cut kids' hair in their sleep. This is just another way to avoid the situation, and the child doesn't get to participate in pairing up aversive interventions. So I don't recommend that you do things to a child when they're sleeping. I instead recommend that you assess, come up with a plan to systematically desensitize the child to all kinds of aversive events. So in addition to figuring out the location you're going to practice, we're also going to need to determine the people that are going to be involved. And I know I interviewed a former client's mom, Jenna, recently, and I know when I worked at her house years ago with her then 2-year-old son, Cody, he was very aversive to taking a bath. And so that location, easy, the bathtub in the main bathroom, where that's the only bathtub they used. But what she was doing that we changed was, in order for Jenna's husband to give Jenna a break, Cody's father and Cody's mother were both taking turns, and it was just a battle every time they tried to give him a bath. The problem with the father doing it was that I wasn't able to train the father because he was at work. So Jenna and I decided that in order to have Cody have the best chance of success, we would actually have Jenna be the only person to give Cody a bath for a couple weeks or a couple months until we got the bathtub desensitized, because that was a problem. And if he's thrashing about, he could bang his head, he could slip and fall, and we didn't want it to be an all-out struggle. So determine the location, determine the steps, determine the person or people involved. If you're in a school setting and you're trying to practice any kind of haircuts or doctors or dentists, the less people involved, the better, because there will be shaping involved, and a lot of it is part science, part art, and part like dancing with somebody. Like, you have to kind of feel when you need to prompt or reinforce. I hope you enjoyed that short snippet from podcast number 195. If you did, I'd love a thumbs up. Share it with somebody who might benefit. And for more information about joining our online course and community, where you can really learn step by step what to do in all kinds of situations and how to increase talking and decrease tantrums and work on all of these skills at the same time, attend a free workshop, marybarbera.com/workshops, and I'll see you right here next time.